It is a simple yet profound concept that is transforming the operating room experience for staff and patients at university hospitals. It's called the compassion pause. In this interview, it's personal to me. I have experienced this firsthand after having surgery last year for prostate cancer. So let's bring in our guests here. Joining me right now are PJ Lopez, Chief of Pediatric Urology, and Dr. Juan Moldes, who spearheaded the compassion pause. I want to thank both of you for coming in this morning. I have been looking forward to this for a long time. Before we get into the questions and dive deep into this, let's take a look at a clip that we have to talk about what we are talking about.
Now the compassion pause. So take a deep breath and be conscious awareness of this important moment. Be fully present here and leave outside of this OR all the thoughts that are not related to this patient, and focus in our job that we have, trying to alleviate this patient and the suffer of this family.
All right, so there you have it. For who either wants to jump in first, just explain exactly what this is and what we just saw there.
So this is like a moment that we bring to our surgeries of consciousness about the human the shared humanity that we have with the patient. So it's bringing that conscious of that we are present there, that this is much more than a surgery. This is we are working with a human being, and this is an invitation to connect with that humanity that share with the patient, and that this is not just a surgery. It's much more than that. So it's recovering the importance to be there with all our presence. In a very special moment for the patient with extreme vulnerability. So hearing the patient's fears, the feelings, and be there just for the patient also, and also for us, because the pause that you show there is a pause centered more in the OR team, but in adults we do a little different pause than that, where we involve the patient in that moment.
I could tell you firsthand, it's one of the most impactful moments of my life, maybe top 3. I mean, it was, I wasn't expecting it, no idea it was coming, to have everyone around me to, introduce themselves, and I just felt so comfortable. Where did the idea come from?
The idea came from him. So he has been in a journey, and probably he can tell us better than me, trying to recover the humanity when we start studying medicine, or everybody who is in the health system. And then you got in a pre-med 7 years, and then the residency and the fellowship, and you start losing all the things, start focusing what you do in the daily basis. And then you said it's another surgery, and probably you forget the name, or you don't talk about the name of the patient, you talk about the procedure, and then it's all about, I don't know, a knee replacement. Oh, we do a knee replacement at 9, yes, it's the guy of the knee replacement here. And this is bringing back to that humanity. So we're talking about David, his surgery, what he's feeling, and what we can do to help him in this procedure. So moving the technical issue to a more humanity thing.
What's been the reaction that you have gotten from patients? You heard mine. What has been the reaction?
So the first time we did this pause, that I was having this idea for many years. I was doing meditation and training in compassion. So when I brought that idea to the surgery, and when we arrived here, I talked with PJ about this idea. He said, "Yeah, let's do it." And so the first time we did it, almost the anesthesiologists and our team, they became in tears, and we do pediatric urology, so we don't see what is happening with the adults, but with Liponsky and other surgeons who are doing this, we can see the different videos or records and telling what the patients feel about that. And so what it's doing is transforming the experience that the patient has at that moment, and also in our team. So
almost opposite of what you were trained, right?
Absolutely.
Yes and no. So I think that there's some humanity in the training, in the frame, but when you go to the really assignment that you need to learn and do, yes, you're losing that. And that's probably why we are moving this, or try to move this from the compassion port, that is a 30-second things in the OR or in any procedure room, to something more wide, more open, trying to expand this to all the surgical fields, to try to teach this, to just come back to the schools and just getting back to our daily basis things.
Well, I want to thank both of you. I got to tell you,
Thank
for
you.
coming in
Thank you
and
for having
for
us.
creating this, because it really, you know, this whole experience changed my life, right? And I want to thank you for that. Dr. Ponsky was fantastic, and that moment I'll never
Can I
forget.
ask you something?
Sure.
What were your experience there?
I'm sorry?
What did you experience there?
What did I experience?
Yes.
Well, I just knowing that everyone in there was about that, you know, that they cared about me at that moment, and I knew that no matter what, they were going to put everything aside, right? And also too, I was about to doze off, so like, you know, I don't remember it completely who everyone was, but it was an amazing experience, totally. And I apologize, but that we have to go. But we will continue on, and we will talk more with you down the line about this. But thank you again for coming in.
you.
This was a great experience. And Brissa, I can't, obviously you see what it means to me, and these two gentlemen, outstanding, and we want to thank them for coming in.
And just a great way to calm some nerves before you go into surgery. I mean, there's so much going on, and just to know who's all in the room with you too, it's very reassuring too. Awesome, Dave.
Yep.
Thanks.